Hi, thank you for giving me a moment of your time today to discuss this important topic of reducing avoidable hospitalizations. In recent months, we've given a lot of consideration to this and how to avoid rehospitalizations. And I'd like to introduce today Interact, which is a tool that can help us achieve that goal. First, the problem. We see residents face unnecessary risks from rehospitalizations. Up to 30% of transfers from skilled nursing facilities are avoidable, according to research. This leads to higher readmissions and costs. These hospitalizations disrupt the lives of our residents. They increase stress on families and expose them to health care associated infections. Here at Rocky Mountain Care, a decrease of 15 to 30% in hospitalizations would be huge, which is why we've been focusing on it. Interact, which stands for Interventions to Reduce Acute Care Transfers, is an evidence based program designed for skilled nursing facilities to help prevent avoidable hospitalizations. It was developed by Florida Atlantic University with CMS funding and has been implemented across thousands of U.S. facilities. It's mandated by some states to be used in skilled nursing facilities. And studies have demonstrated not only reduced hospitalizations, but reduced readmissions by 10 to 24%, with savings of up to $1,200 to even $7,000 a year per resident. How it works. Well, there are communication tools like an SBAR form, which helps standardize handoffs, reducing miscommunications. There's the stop and watch system, which helps staff recognize when a change in condition has occurred in a resident to notify the provider so that we can make changes early. There are care paths, 17 different protocols with algorithms for in-house management of common conditions that may lead to rehospitalization, such as urinary tract infection or congestive heart failure. There's also advanced care planning tools that are used for the staff to help discuss with patients and families and clarify the goals of each resident to ensure that unwanted transfers aren't initiated and we're honoring the resident wishes. Additionally, there are quality tools that help track and analyze transfers for continuous improvement. These benefits are tremendous. Interact is evidence-based with a lot of studies that help demonstrate its effectiveness. It's resident-centered for fewer disruptions, meaning they have better quality of life and they stay comfortable in their own home. The financial benefits, $1,200 to $7,000 a resident per year adds up. Another study demonstrated an average of $125,000 annual savings per facility. For our 13 facilities, that would be estimated to be $1.6 million that we could save annually. We would also have the benefit of improved staff morale and hospital partnerships as they see us making an effort to improve the quality of care. There are a lot of barriers to implementing this. The largest is that of the time commitment and the education requirement. I see these as processes that need to be put in place to improve the quality of care. We already have many of these in place, and adopting some of these may help facilitate it. Most of the resources of Interact are free. The training ranges from $250 to $1,200 depending on the role of the person that's receiving the training. We could train as few or as many people as we felt was necessary to meet our goals. Then we could implement it. Train the staff in a 15-minute all staff meeting, assign an Interact champion to help integrate the workflow, and then partner with the local hospitals as we review those root cause analysis for the transfers. The timeline would be probably 3 to 6 months to get this rolled out and get enough people trained to start implementing it with our staff. Our goal, our vision has been people. It's always been about people. Since Rocky Mountain Care was established, our founder got into healthcare because she was trying to help care for the people that mattered most and be more fulfilled in her career choice. Today, our mission and our vision are people. Our focus is people, and Interact can help us improve our ability to care for people across the continuum within Rocky Mountain Care. by decreasing rehospitalizations and improving communication. The time to act is now. If we can improve this, we can start moving forward with the training. We would need to select a specific facility where we'd want to pilot this and then start implementing it as we see fit across our other facilities. Together with Interact, I think we can help reduce the suffering, the costs, and the need for our families and those who rely on us for care. I'll turn the time over to you for any questions as we can discuss further more details about this. Thank you again for your time.